Good evening, everybody. Thank you so much for joining us this evening to learn more about Medicare open enrollment information. I just want to take a few moments to orient you to this space for those of you who aren't familiar with Crowdcast. As you can see, we have a chat. I can never remember if it's to my left or to my right, mirroring of the screen. I'll leave that up for a few minutes. If you have any challenges or you have questions, you can ask them there. But for the duration of the program, we'll turn the chat off. If you have any questions about what Cathy is speaking about, you can hit the Ask a Question at the bottom and just put your questions there. At any point, we'll ask Ms. Forbes at the end. I'd also like to let you know that there's a Get Audio Video Help just next to the Live button. If you are experiencing any lagging in video or audio, then you can check, just click that button and it's enter compatibility mode, and that should resolve any issues you're having. But otherwise, I hope everything will be smooth sailing this evening. We're delighted to work with Cathy Forbes, who is the State Health Insurance Assistant, part of the State Health Insurance Assistance Program. And she's where she works as county coordinator. Cathy, thank you so much for offering this program to us this evening.
Thank you. So what I'm going to do is I'm going to share my screen so you'll all be able to see the presentation. I'm also very happy to share the presentation, the slide set afterwards. So if anyone would like it, you're very welcome to it. And please do, if you've got any questions, pop them in the chat box so that I can answer them afterwards. It is a lot of information, so I just want to let you know I don't expect you to memorize it all or even to get it all. It's just to give you a good overview. Then that way, if you would like to either speak to me or one of our certified SHIP counsellors, we can set that up afterwards. So I'm just going to share the presentation and then we'll go from there. So here we go. And we'll just start the slideshow. Okay, so I'm going to go through Medicare in Mercer County, how it's going to be looking for us in 2021. Now, as I've already been kind of introduced, I am the coordinator for the SHIP program in Mercer County. You will see that you have got, you can email me. That is my telephone number. That's my direct line. It is also a cell phone. So if you would like to text me, I'm always happy to accept messages by text and also by email. And we are also now on Facebook. So at the moment, it's a lot of our national posts being shared, but as we grow, hopefully we'll be able to share more interesting information as we go along. So what is SHIP? Well, it's the State Health Insurance Assistance Program. It's a federally funded program that is designed to provide information about Medicare that is local. So the people you speak to are going to be in the same county as you. It's in depth and it's objective. We're not selling anything to you. We don't work for Medicare. We don't work for the state. We don't work for the government. I see it that we're working for you. That's why I say it's federally funded. We're not government employees. The majority of our certified SHIP counsellors are in fact volunteers. The real benefit of that is that you are speaking to people who are doing this because they want to do it. So they will give the time and they really want to help you to understand what to do to make the right choices. We're here to answer questions from anybody. So whether you're the one on Medicare, it's your family, someone you're working with, we'll always do our best to answer your questions. The name of the program does vary from state to state. This is a program that runs in all 50 states. Here in New Jersey, it's called SHIP, but if you were over the border in Pennsylvania, you'd find it would be called a prize. Down in Florida, they call it Shine. And I say to people every time, my favorite one is Ohio, where it's called OSHIP, because I think that's what people tend to think when they find out they're going on to Medicare. So just want to run through, make sure we're all in the same place. So in terms of eligibility for Medicare, you become eligible for Medicare when you turn 65 or if you've been receiving Social Security disability payments for 24 months. Now, if you are collecting your Social Security cash benefits at the time you become eligible, you will be automatically enrolled into Parts A and B. This used to be a lot more relevant when people were collecting their benefits at 65, so a lot of people automatically enrolled. if you are not collecting your benefits until 66 and you have no creditable health insurance, so insurance that Medicare would consider creditable, you will need to contact Social Security in order to enroll. So a lot of people talk to me about the different time periods. The thing is that when you're talking about so a lot of people talk about the initial enrollment period, which is a 7-month period, which starts 3 months before the month of your 65th birthday, the month of your 65th birthday, and 3 months after. But that isn't the only time you can enroll in Medicare, because you also get, I just want to draw your attention to the special enrollment periods. So if you have waited to enroll in Medicare Part B because you or your spouse had creditable coverage, which basically means you worked for a large employer, then when you stop working, you will have a special enrollment period that is specific to you. It's 8 months from the point where your coverage ends. So I just want to point that out because I don't want anyone panicking. There are penalties for late enrollment. I'm going to go through when you do need to enroll, but I just want to reassure you that you don't have to enroll when you turn 65 if you have creditable coverage. So when we talk about Medicare, a lot of the time we will say that Medicare has 4 parts. Now, each of those parts has its own monthly premium. It will have its own deductible, has its own cost sharing rules for services, and it has its own rules for enrollment. So incredibly confusing. I am quite a visual person, so I find this a really good way of explaining the different parts. So Part A, which is original Medicare, that means that this is the hospital coverage. It will provide partial coverage for your inpatient stays if you go to skilled nursing care, which most of us call rehab, hospice care, and home health care. And I say partial coverage because just by having Part A, it doesn't mean that you won't have amounts to pay to use those services. Part B of Medicare, again, you're not, just by having Part B doesn't mean that you have no out-of-pocket for these different services, but you're looking at, that covers doctor's visits, if you had to have surgery, outpatient surgery, lab tests, medical equipment like a wheelchair or hospital bed, the preventive exams. So it's your medical coverage. Those two are original Medicare, and that's what you would see on your red, white, and blue card. Part C of Medicare, this is probably the only time you're going to see it referred to as Part C, is in a presentation like this or in your Medicare Renew handbook. That is because we know it much better as Medicare Advantage. When it was originally conceived, it was thought that it would stand for Medicare Choice, which is why Part C, but it is an Advantage plan. Now, with that, you do have to have Medicare Parts A and B. But instead of showing your Medicare card when you go to a provider, you show your Medicare Advantage plan card. And it will, again, cover or provide partial coverage for your hospital care and your medical care, but it can also provide additional services not otherwise covered by Medicare, such as vision, hearing, eyeglasses, and even some additional services on top of that. Part D of Medicare is your drug plan. So that is, again, it's not on your Medicare card. It's something that you have to buy through a private insurer, and it's to help with the cost of your prescription drugs. Now, I'm going to go through each part in detail now, or a little bit more detail. So Part A of Medicare, this is your hospital coverage. For most people, there is no monthly premium. That's because if you paid your Medicare withholding tax, or your spouse did, for a minimum of 10 years or 40 quarters, then you were entitled to a premium-free Part A of Medicare. If you are somebody who, for example, was a federal worker that didn't pay the Medicare withholding tax, or if you're somebody whose employment history or your spouse's employment history were all overseas, you may not have sufficient credits or quarters for premium-free Part A, and the costs of buying Part A are quite considerable. However, there is no late enrollment penalty for Part A because it's premium free for most people. The big cost comes if you are actually admitted to hospital. So in 2021, the deductible, if you are considered an inpatient, will be $1,484. That's a $76 increase from last year. It is a big chunk of cash. Once you have paid that, your bed and board is covered for the next 60 days if you're in for hospital for that long. But it is a benefit deductible. So that means that if you are discharged from hospital and you stay out of hospital for 60 or more days and you're then readmitted, you would pay that deductible again. The reason I talk quite a lot about the deductible and how high that is because it helps to explain why there are higher costs when it comes to insurance to help protect you from things like this deductible. Now, Part A also covers your inpatient rehab, but it will only cover your rehab stay if you've had a qualifying hospital stay first. That means that you have been an inpatient for 3 midnights. So you've been in hospital for 3 night times. The reason I mention that is because you can be in hospital but be considered an outpatient. You will receive a notice telling you if you are an inpatient or an outpatient. Most of the time, this is only is relevant to how you're being billed, but it is important to know because you want to ensure that your rehab stay will be covered. Now, during the pandemic, this requirement has been waived for some of the time, just because, understandably, nobody really wants people hanging around in hospital just to get to the 3 days if they can safely get out. But it is something to be aware of. If you are in rehab for more than 20 days, then you would have a copay for days 21 through 100. And then you would not be able to continue with rehab unless you're readmitted to hospital. And that's because rehab should be seeing you improving and getting better. Now, Part B for boy of Medicare, this is the one that has a premium that is deducted, if you're collecting Social Security, that is deducted from your Social Security check. We now know what the monthly premium will be for most people in 2021, and it will be $148.50. So that's going up about $4 from last year. Now, if you are considered a high earner, which means that the income on your last tax return was more than $88,000 if you're single, or $176,000 if you filed jointly, then you will have a higher premium. But bear in mind that your last tax return is generally looking at what your income was 2 years ago. So if your income, now that you're on Medicare, or if something else has changed, is now lower due to a life-changing event, so for example, you lost your job, or you became widowed, or something that's significant, you can appeal that higher premium. You use the form SSA 44. It is completely worth it. It's a couple of pages, the form, but it is worth filling out because you can save money. If you don't have to pay that higher premium, then you should just fill out that form and get yourself reassessed. You may need to fill out for 2 years running, because remember, the tax return is always from 2 years ago. So if things have changed, you may have to fill it out twice till everything catches up, but just be aware of it. If you're at the other end of the income scale and your annual income is less than $17,466 if you're single, or $23,514 if you're married, and you have limited assets, so less than about $7,500 if you're single, and I think it's $11,400. Don't quote me exactly on that if you're married. Then you may be eligible for the SLMB program, which is the Specified Low Income Medicare Beneficiary Program. That is a program whereby the state will pay your Part B premium for you. Again, if you think you're entitled, please, this one I can apply for you. So please just get in touch with me and I will talk you through the process. It is worth doing because $148.50 is a lot of money coming out of your check every month if you don't need to pay it. Again, we now know what the Part B deductible will be in 2021. It's going up $5, so it'll be $203. Once you have met that deductible, and it is annual, so once you have met that deductible, then Medicare will pay 80% of the Medicare approved rate for your covered services. So this is the 80-20 split that a lot of people remember, but it only refers to your Part B of Medicare, B for boy, your medical coverage. Now, we talk about the Medicare approved rate. Basically, what happens is that federally, Medicare has assigned a rate for each service. So for every service that there's a code for, there is a Medicare approved rate that has been assigned to it. If a provider accepts Medicare assignment, they cannot charge any more than the Medicare approved rate, regardless of what they would charge someone without Medicare. They cannot, once you have Medicare, they cannot charge you more than that. However, if a provider says that they accept Medicare but not Medicare assignment, they can charge up to 15% over the Medicare approved rate, and that's known as the limiting charge. In New Jersey, from what I understand, you're most likely to see this maybe with certain mental health providers, and I think that's probably because mental health and its costs are less well understood than physical health. Or the 2 times I've come across it, it's actually protected Medicare beneficiaries from being charged whatever the provider wanted to charge. So there was somebody who was seen by a plastic surgeon to sew up a wound because that was who was available in the ER. They wanted to charge an eye-watering amount to do this. However, because the person had Medicare, they could not charge more than 15% over the approved rate for that service. And if they try to do more than that, then it would be considered fraud. So our colleagues over at the SMP, the Senior Medicare Patrol, they helped this lady make sure that she wasn't overcharged for the service she received. Now, I talked about that you may want to delay your Part B enrollment, because if you remember, you don't want to pay that $148.50 until you need to. And you can defer Part B enrollment once you become eligible for Medicare if you are still working and covered by health benefits from a large employer, or your spouse is working and gets health benefits through their large employer. But if you are on COBRA, if you are covered by a small employer, and a small employer, if you are over 65, isn't someone with less than 20 employees, or less than 100 if you're on Medicare due to disability. If you only have retiree coverage, if you have marketplace coverage, or you have no other healthcare coverage, then if you don't enroll in Medicare, you would be liable for a penalty. And that's where those enrollment periods come in. So if it's when you are turning 65, you will need to enroll either 3 months before the month of your 65th birthday, the month of, or 3 months after. Or if your working coverage is ending, you have 8 months in which to enroll in Part B of Medicare without penalty. This has particularly been relevant with everything that's been happening with the pandemic, where people have been lost their job and have been offered COBRA. Although you may be offered COBRA for a year, bear in mind that you need to enroll in your Part B within 8 months. Otherwise, you'll be liable not only to a late enrollment penalty, but you have to wait for the general enrollment period, which is January 1st through March 31st each year, to be able to start on Medicare, and your coverage doesn't start until July 1st of that year. I don't expect you to remember all of these dates. Just remember, you need to either have creditable coverage, which is through an employer and you actively, or your spouse is actively employed, or you need to get your Medicare. So Part C and D of Medicare are considered optional. So you won't see them on your Medicare card. As I said, Part C is better known as Medicare Advantage, and most situations, the Medicare Advantage plan will include drug coverage. And Part D for drugs is the Medicare drug coverage, the standalone plans. It wasn't until 2006 that the government realized and appreciated that most older people do take medications, and it was in 2006 that Part D became mandatory. You usually cannot have both a Medicare Advantage plan and a Part D drug plan. The exception to this rule would be the New Jersey State Health Benefits Plan, where you do actually have a Medicare Advantage plan and a Part D drug plan, but if you are buying it on yourself, then it's one or the other. Now, although Medicare drug coverage is considered optional, once you become eligible for Medicare, you are required to have creditable drug coverage. And if you go more than 2 months without drug coverage, then you are liable for a penalty. And that penalty is calculated based on every month that you don't have drug coverage when you should. So if you have drug coverage through an employer, through a retiree plan or a union plan, that's going to be creditable. If you have no drug coverage, in fact, I'm going to talk about this on the next page. Here we go. I do this every time. So creditable drug coverage has to be as good as a basic Part D drug plan. So generally, employer, union, or retiree coverage will be suitable, and the insurance company can confirm. Drug coverage as part of a Medicare Advantage plan would be creditable, but what is not creditable would be a prescription discount card, so like GoodRx, a drug manufacturer's program, or the pharmacy or supermarket programs like Sam's Club. Now, although it seems frustrating to have to pay for drug coverage if you don't take any medications, it works out that for every 12 months that you don't have creditable drug coverage, your penalty will be that you'll pay an extra $4 per month on top of any premium when you do enroll. The lowest premium plan for 2021 is only $7.30. So even if you don't take any medications, it still makes sense to enroll in the lowest premium drug plan just to avoid racking up that penalty. So I'm just going to talk through your coverage choices. So you can either have original Medicare, which means that when you go to the doctor, the card you will be showing is your red, white, and blue Medicare cards. That's your hospital insurance Part A and your medical insurance Part B. You can choose to add to that prescription drug coverage through Medicare. And you can also add Medicare supplemental insurance. Now that may be through an employee, through a retiree plan, or we would call it, a lot of people know this as your Medigap policy. That is one route to go down. The alternative would be to get a Medicare Advantage plan, that Part C. So this is where it gets a bit confusing because the letters don't all stand alone. So Part C, these are generally going to be either an HMO or a PPO plan that will typically include drug coverage, and they will provide you, the Advantage plan will basically provide you with your hospital insurance, your medical insurance, and your drug coverage all rolled into one card. You are still enrolled in Medicare, but the bill will be going to the Medicare Advantage insurance company, and that is the card that you will be showing. So if we think about that original, I'm just going to go back. If you think about that original Medicare, if you remember, I said to you that you've got that $1,484, $1,486. Sorry, the figures only came out this morning. I think it's $1,486 for your Part A deductible as a big chunk, and then you're looking at 20% of the cost of your Part B. That's where the Medigap plans come in. These are plans that pay after Medicare pay, and they help protect you from the parts that Medicare doesn't pay, so the deductibles and the co-insurance. Now, there are currently 10 plans labeled A through N. You can tell there are some plans missing, so some plans have already been grandfathered. There are 2 plans, C for Cat and F for Frank, that are not available to people who became newly eligible for Medicare this year, but can still be purchased if you got your Part A of Medicare prior to January 1st, 2020. The reason those 2 plans have been grandfathered is because those were the only 2 plans that covered the Part B for boy deductible. When that news was shared, there was some suspicion that that might mean the Part B deductible would go up a lot, but it has only gone up $5 this year, so that hasn't come to pass. Now, every plan of the same letter must offer the same coverage. These are federally standardized policies. So the only variation is the premium cost. Now, there may be differences in how the customer service works for each plan, and certainly some companies will have names that are more familiar, but the plan coverage itself has to be the same. The premiums range generally from around $100 to $350 per month, depending on the plan letter, your age, and your gender. As you get older, plan rates go up and men pay more than women. That is because the premiums are based on what's being paid out in claims from your population that's enrolled. So as people get older, they are more likely to make claims, which means that the premiums can be increased. The premium increases do have to be proposed and approved by the Department of Banking and Insurance. They're proposed to them and they have to approve the increases. And that does mean that if you've got a plan that is new on the market, it may start out a lot lower in premium than some of the more established plans. And as more people enroll and make claims, you may see those premiums increase faster than they would from a plan that is a plan that's more established. Some companies do offer household discounts, usually around 7%. So if there's two of you, it's worth looking for a plan from the same company. And just to let you know that although your premium will increase with your age, and also, I said, men more than women, it's not related on your related to your own claim history. So it's not like car insurance. So if you make a claim, your premium will go up specifically. It's just that if everyone's making a claim, the premiums will go up. If you're the only one making claims, everyone else is healthy, you won't see such an increase. And as long as you pay your premiums, you cannot lose your Medigap plan regardless of your health status. With a Medigap plan, what you're buying with that high premium is I say to people, you're buying peace of mind and flexibility. You're buying peace of mind because you know what you're paying every month. It's much easier to budget. You're having less unexpected expenses. The flexibility is you can go to any doctor, provider, or hospital that accepts Medicare in any of the states of the US. They are national plans. And you do not need referrals or prior authorization. So depending on the letter of the plan, it will cover some or all of the deductibles. They all cover the Part A deductible. So that's why I said to you that's a big cost. That's why the premiums are high. And it will cover a lot of the co-pays and co-insurance. The plans will pay after Medicare pays, so they will only cover Medicare-approved services. And that means that the plans cannot offer any real additional extras. They can, I think, offer you some things around trying to keep you healthy, but it's not as comprehensive as what the Advantage plans can offer. So if you have original Medicare, you will see on your Medicare card your hospital coverage, no premium for most people. You see your medical coverage. As you see, the monthly premium has gone up, as has the deductible slightly. And during this open enrollment period, which is October 15 through December 7 every year, what you need to review is your Part D drug coverage. Now, if you have Medigap coverage, you can change or review that at any time of year, but you would be subject to medical underwriting because you wouldn't have a guaranteed issue and you could be turned down for a new plan. With a Medigap plan, when you first get Part B for boy of Medicare, you have 6 months in which you cannot be turned down for any Medigap that's available for you to buy in New Jersey, and you must be charged the preferred rate for your age and gender. You cannot be charged extra regardless of your health history. But after that, you would be subject to medical underwriting, so you could be charged more, or you could be turned down for a new plan. With a Medicare Advantage plan, you're still going to have your red, white, and blue Medicare card, and you do have to have both Part A and B in order to have a Medicare Advantage plan, but the Medicare Advantage plan will set its own cost-sharing rules for Parts A and B. And there's a maximum medical out-of-pocket, sorry, that says 2020, should say 2021, will be $7,550 for network care, for in-network care. It goes up to $10,000, I believe, for out-of-network care. Now, you do have to be enrolled in Parts A and B to have a Medicare Advantage plan, but you don't show your Medicare card. So some people feel that they've had their Medicare taken away from them. That is not the case. What has happened is you are still enrolled in Medicare, but Medicare has sold on your risk effectively to the Medicare Advantage plan company. For each beneficiary who is enrolled in a Medicare Advantage plan, the Advantage plan company receives about $800 or $900 per month. That money they then have to use to meet your healthcare needs. And if your medical costs go above that $7,550, they have to meet all of your medical needs after that, not drugs. That's kept separate. So there is an incentive for the Advantage plans to try and keep you healthy. There's also an incentive for them to try and enroll you, and they'd love to enroll only healthy people if they could do that, but they're not allowed to. So that means that when they offer some of their additional benefits, traditionally it was a lot of things like gym membership because they want to keep you well. Also, you will often find that the primary care co-pays are low. Again, it's about keeping you well and healthy. Now, that's good because we all want to stay healthy. But it's just to bear in mind, you do need to look at what some of the other costs would be. I also don't want you to think that I'm saying that these insurance companies are out to get you. That's not what I'm saying. They have been really good during the coronavirus pandemic. A lot of them have waived all the co-pays associated with COVID-19 for those people who got it. So they are trying to look after people, but it is a business and they are receiving money for having you enrolled, and they will give away some sweeteners to try and encourage you to enroll, but you need to work out what's right for you. So during open enrollment, you do want to review your plan choice, and you can, if you want to, go back to original Medicare with a Part D drug plan. But switching between the two is not always as easy as you think. It's very easy to go from original Medicare to a Medicare Advantage plan. You can do that every open enrollment, and now you cannot be turned down for a Medicare Advantage plan on offer in your county. Used to be, if you had renal failure, you could not enroll in a Medicare Advantage plan as a new person. You now can, but just bear in mind that your dialysis will cost about $50 per time until you reach that maximum out of pocket. It's also very easy to go from a Medicare Advantage plan to original Medicare with a drug plan. You can do that every open enrollment during the fall. And then there's also a new Medicare Advantage open enrollment period, January 1st through March 31st, where you can either change between Advantage plans, make one change, or you can go to original Medicare with a drug plan. But what is really difficult is to go from an Advantage plan to original Medicare with a drug plan and a Medigap plan. Because unless you have that guaranteed issue right, then purchasing a Medigap plan will be subject to medical underwriting. A guaranteed issue right would happen if the Medicare Advantage plan that you have ceases to be available in your county. That could be because it's terminating, or because you move out of the coverage area or into an area which has more Advantage plans on offer. Equally, if you had a Medigap plan and that Medigap plan, the company offering it went bust, again, you would get a guaranteed issue right. But otherwise, it's pretty tough to get one. Another time would be as well if you had employee or retiree coverage that pays after Medicare pays and that's ending. Again, you would get the opportunity to buy a Medigap plan. Now, I talked about that during this period, if you have original Medicare, you need to review your Part D prescription drug plans. These are drug plans that are offered by insurance companies contracted by Medicare. Each plan must offer at least 2 prescription drugs in each treatment class where to exist. They cover insulin and your supplies for injecting insulin, but not the test strips. They come under Part B of Medicare. And they do cover the cost of most vaccines, and that's both the cost of the drug and the fee to administer. So it's come up a couple of times recently, but for example, the shingles vaccine, the cost of that comes in, it seems to be around $135 to $150 for a dose of Shingrix. Now, if a drug is not on formulary, then you must pay the full cost of the medication. There is like everything, there's an exception to every rule. The exception is if you start on a medication in the middle of the year, you can apply for what's called an exception to have that medication covered. Now, some medications will never be covered by Medicare, such as vitamins. Like stool softeners would be another one, what are considered lifestyle drugs, so they would not be covered by any. But if you started on a medication that would be on the formulary of another plan, but isn't on yours, you can have an exception to have it covered, but you would need to review your coverage the following year. Each formulary drug is assigned a tier. Generally, the higher the tier, the more you pay. The only exception to that is tier 6. Not all plans have tier 6, but where they do offer a tier 6, it is for clinically effective, low-cost medications. And you're going to pay something closer to a tier 1 or 2 cost for those. But generally, 1 and 2 are your generic medications, 3 and 4 are brand names, and tier 5 are the specialty medications, the ones that you're likely to see advertised on television. Now, the premiums in 2021 in New Jersey have a big range. They go from that $7.30 per month all the way up to nearly $100 per month. And the median premium for next year will be $34.40. In 2021, the maximum deductible is $445. Not every plan has the deductible, and not every plan that has a deductible applies it to every tier. So you may find that if you only take generic medications, that the deductible doesn't apply to them, and that you will never reach the deductible during your year with the plan. Once you've met the deductible, there are 3 further coverage periods. You have the initial coverage period where you pay either a percentage of the drug cost or a fixed copay, up to a point where both you and the insurance have paid $4,130. So that is not fully coming out of the cost, out of your pocket. Once you reach that, you go into what's known as the coverage gap. It used to be called the donut hole, because when you went into this, you paid 100% of the cost of the medication. Since the introduction of the Affordable Care Act, that has gone down. You now pay no more than 25% of the cost of the medication, and it will either be Medicare or the manufacturers that pay the rest. And you get up to a total of $6,550, and then you go into catastrophic benefit, at which point you pay no more than 5%. So you either pay, those figures are slightly wrong. It's $4. It's just under $4 and $9.20 for the copay, or 5% of the cost of the medication. Now, for some people, when you go into the coverage gap, you will find you actually pay more than other periods, because you're now paying 25% of the cost of the medication. But for most people, once you get into catastrophic benefit, if you get there, then you will be paying less. Like I said, some people never get out of the deductible period. Other people go through all the coverage phases in the first month. It just depends on the medications you take. There are 30 plans on offer in New Jersey for 2021. That's 2 more than there were this year. There are 5 plans with monthly premiums under $17 a month. The lowest premium plan is SilverScript Smart RX. It is one that I want to say, I don't have it in front of me because I'm not in my usual office this evening, but I think you cannot use it at Walgreens. There is one pharmacy network chain you cannot use it at, so if that's a deal breaker, it may not be the best plan for you. But if you don't take any medications and you're willing to go to the pharmacies that it works with, then that's going to be your cheapest option. There are 17 plans that have 0 deductible for at least some of the tiers, and there are 4 plans that offer extra coverage in the coverage gap, but just to bear in mind that even when that's offered, it's only on certain drugs. Just a note that there are plans called SilverScript, but they are actually now owned by Aetna. Slightly confusing. New also for 2021 is something called the Senior Savings Model. This is relevant for people who take insulin. We actually have not found that this is necessarily making a big difference when we're looking at plans for people for next year. And that's because the costs of other medications are often higher. But the idea of the Senior Savings Model was to keep the cost of insulin the same through all the coverage phases, and therefore for people to pay less on their insulin. Not every plan offers the Senior Savings Model, and it's something that CMS, the Centre for Medicaid and Medicare Services, will be reviewing as to what the take-up is and how useful it is. So how do you find the most cost-effective drug plan? Well, you don't have to go through by hand all 30 plans. Medicare have produced a really handy tool. The information comes from the drug plan companies. They provide it to Medicare. They put it into their database. You enter your current medications, the dose and the frequency. You put in your preferred pharmacies, and basically it will churn out the plan with the lowest cost premium and medication cost for you. It'll actually do all 30 in order, but you can see what the cost will be. When you're using this tool, you do want to go to www.medicare.gov. That's G-O-V for government. If it's .com, just be aware that it may not cover all 30 plans, for example, or it may prioritize certain plans over another because that's common for commercial. Now, if you have a My Medicare account, so just like Social Security promoted the My Social Security accounts, Medicare has been promoting the My Medicare account. The benefit of the My Medicare account is you can see in real time what your Medicare claims are if you have original Medicare, but also it allows you to access the plan finder and it will pull the medications that you take. That can be useful because when you are looking at your medications, there are some where there are lots of different formulations of the same medication. So you're looking at, are you having extended release? Is it the dissolvable one? And so on. Saves you from having to get all that off of the bottle because it will be what was actually issued by your pharmacy. Now, when you get that plan with the lowest cost premium medication cost, just be aware you want to look for any coverage restrictions. So quantity limits, that tends to come up quite often, for example, on statins, because you're only supposed to take them once a day. So they will, you'll only be covered to be able to have 30 per month or 90 per 3 months. You also might want to look at if there's prior authorization. Usually fairly easy to resolve. Your doctor just lets the company know that that you need this medication. They authorize it. The one that I would just be wary of is where you need step therapy. Step therapy means that before the insurance plan will cover the more expensive medication that you want, they're going to require you to have tried other medications first. If you know that isn't going to work for you, then step therapy, if that's required to get the medication you want, it may not be the right plan. The other thing to be aware of is that some plans are national plans, which means that you can use them in any state. Others are not national, so you may be limited if you want to get your prescription filled out of state. Every year, I can't say it enough, review your plan choice during this annual enrollment period. Even if you haven't changed medications, even if the plan is has only increased the premium a couple of dollars, you can find, I've worked with people this annual enrollment period where making a change will save them a couple of $1,000s next year. You might do it and find it's a $40 difference and it's not worth it, but at least you know. And I say to people, it's money then in your pocket rather than an insurance company's pocket. So there are programs, Part D. I know drug costs are really expensive, and they are. So there are programs to help with Part D prescription drug costs, and there are some that are specifically just for people who live in New Jersey. These 2 state pharmaceutical assistance programs are 2 of the least utilized or most underutilized programs on offer. One is called PAAD, or Pharmaceutical Assistance to the Aged Disabled. With that program, the state of New Jersey will enroll you in a Part D plan and pay the premium and any late enrollment penalties. So if someone comes to me and they don't have a Part D plan, this is one of the things I always want to check. Caps the cost that you pay at the pharmacy to $5 for generic and $7 for brand name covered medications. But there are income limits, but it does not take into account any assets. So in 2020, if your income is less than $23.67 per month if you're single, or less than $2,900 per month if you're married, then please, again, get in touch with me. These are gross. I have to say these are gross income figures. So if you're having your Part B premium deducted from your Social Security check, we have to add it back in to get the figure. But I'm happy to go through that with you, or anyone you might know. Please let them know, and I can go through the eligibility and also the process for applying. If you're not eligible for PAD, there is also the Senior Gold Prescription Discount Program. Now, this one wraps around your drug plan. It is relevant if you pay more than $15 for any of your co-pays. And it also, if you reach a maximum out of pocket of $2,000 if you're single, $2,000 if you're single, or $3,000 if you're married, then you only pay $15 maximum for each of your medications after that. So even if you're not on any expensive medications, if you or a family member is eligible, I would again recommend enrolling. The reason being that it's there if you get a surprise high cost medication. And you've got the figures on there for the costs, for the for the income, sorry. Like I say, your assets aren't taken into account, only if you're earning money from them. So I know that at the moment, the interest rates are not great if you're a saver, but if you were earning a large amount of interest, that would count. But the amount in the bank wouldn't. Now, there is a federal extra help program. You'll be automatically enrolled in this program if you're on Medicaid or you get assistance with your Part B premiums. This also has an income limit and an asset limit. But if you think you're eligible for PAD, I will screen you for extra help at the same time. These programs are all applied for through the NJ Save application. This is it's been pushed as an online service by Governor Murphy. It's one application that it screens for the programs that help with prescription costs and also help with utilities. You can apply yourself online through aging.nj.gov, or if you would like any help applying, I'm very happy to do it. I can do it over the telephone and send you a paper copy, a printout of the application we send. Now, when we're doing these applications online, I say to people it takes 1 to 2 weeks to be approved. I actually completed an application for someone yesterday over the telephone. I was in our workers portal just having a look because I was doing someone else's application, and I thought, that's strange, that's moved very quickly, and the person had already been approved for PAD. So if you need help, please get in touch. It is not taking a long time. Now, the Medicare Advantage plans, if you haven't got original Medicare, you've got a Medicare Advantage plan, remember, again, you're going to review that this time of year. A lot of people talk to me about them because there's so many adverts on television and flyers coming through the door about them that it can be overwhelming. So these are plans that are offered by insurance companies, also contracted by Medicare, and they will be structured as HMO or PPO plans. If it's an HMO plan, that means that you have to stay in the network. If it's a PPO plan, you can go out of network, but you may have to pay more to go out of network, and the provider still has to agree to see you as an out-of-network person. So with an Advantage plan, you must get all your medical services and drugs through the plan. You may have to use specific, or you will have to use specific doctors, hospitals, and labs, or you may be paying more. You may need pre-approval or referrals. This can be particularly frustrating. Some people have found, like an MRI, if they've not if they've had original Medicare and not had to get pre-approval. The copays and fees for services do vary between the plans, so you want to have a look at what that might be. And all the claims will be processed by the plan rather than by Medicare. So you don't have to carry your Medicare card around with you, because what you're showing when you go is your insurance, the card from the Medicare Advantage plan insurance. Now, they can offer additional benefits. So before 2019, it was generally basic vision, dental, and hearing coverage, and gym membership. That's what was offered. Since 2019, the plans have been able to offer a lot more benefits. That can be dental riders or more comprehensive dental coverage, some home delivered meals after a hospital stay, although it's often only once per year. Dollars that you can use for over-the-counter healthcare related items. So that can help you with things like the cost of vitamins, or for bandages, or adult diapers, things like that. Some will offer transportation to medical appointments, but again, just watch how many or how much transportation. I know for some of the plans that offer it, it's 12 one-way trips. Well, you usually have to get back, so that's really 6 appointments. That's not that many. Each plan has a summary of benefits that will give you the details, but remember, those benefits are there to encourage you, so look at all of the costs. The premiums for the Advantage plans, they range from as little as $0 to $104 per month in 2021. You still have to pay your Part B premium, because you have to have Parts A and B. If you are enrolled in PAD or get the federal extra help, you can get a discount of up to $35.50 on your Medicare Advantage plans. It's basically you get a discount on the drug premium portion of the plan. And remember, your medication costs will still be capped at the pharmacy counter. The primary doctor copays, they range from $0 to $35. And the specialist doctor copays range from $5 to $50. So if you don't go to the doctor very often or hardly at all, you might want to go for a plan that offers you more benefits, but you will probably, and low premium or no premium, but you may run the risk that when you go to the doctor, you'll be paying more. But don't forget, those are the costs of other items. So for example, an ambulance trip is usually about $200 to $250. There are inpatient daily copays. If you remember, I said the deductible for Part A is $1,484. $1,486. So still not sure on that. But if you've got a Medicare Advantage plan, you're going to pay $300 to $400 per day for the first 5 or 6 days. And if you're discharged and readmitted, that resets. You start paying again. You would have a fixed copay for outpatient surgery, probably around $250 to $300. Investigative tests, for example, an X-ray, they usually run around $30 to $50. Copay for mental health services, copay for therapies. I spoke to somebody who was saying that with their Advantage plan, the cost for, they had the cost of the cert for knee surgery and then the cost of physical therapy afterwards. The physical therapy was going to cost $600 because they were going to have to go 3 times a week over a period of weeks. And I think it was a $20 copay. So the costs come as you use services. I say to people, the Medicare Advantage plan, you're paying less on a monthly basis, but it's much more of a pay as you go. So if you use services, you will pay more. There is that maximum out-of-pocket costs on your medical capped, at which point if you hit that, the plan will pay. So you are kind of covered for catastrophic, but $7,550 is still a lot of money that you've got to find before the plan comes in. If you are low income and you have a Medicare Advantage plan, you get admitted to hospital, you can still apply for charity care in the hospital that you're in, but you will have to do it in the county that you're in as well, usually. There are some Medicare Advantage plans without drug coverage, and these are often aimed at military veterans. So that's because military veterans who have drug coverage through the VA benefits are considered creditable drug coverage, so you don't have to get a prescription drug plan, but you do have to use your the VA drug coverage. You do have to fill your prescriptions at a VA pharmacy or facility. So bear in mind that if you're looking for the extras that might be offered by an Advantage plan without drug coverage, and you're a veteran, by getting the extras, you may have the disadvantage of having to go further to get your medications. For those people who see these plans and say, oh, look, and they've got great names now. I think they've got names like Honor and Eagle to show that they're targeting the veteran market. For those people who see you may be offered a discount, for example, on your Part B premium if you enroll in that, you cannot get a separate Medicare prescription drug plan. So you would be losing your drug coverage. And if you then went to get drug coverage at a later date, you would have a penalty. So just bear that in mind if you decide that you're going to go for a plan without drug coverage. And also you can't just pick it up when you want it. Now, if you've got a Medicare Advantage and you're looking at your Advantage card, there are a few things to look at. Your card should tell you the name of the plan, but it should also tell you, is your plan a PPO or an HMO? So do you have to stay in network? If it is an HMO, you might want to know, do you need referrals? If it has Medicare RX on the card, that means that it's got prescription drug coverage. And don't forget to check the costs of services, because although your card will say your copays for primary, specialists, and probably ER, you want to check what the costs are of other things. There are 34 different Medicare Advantage plans going to be available in Mercer County for 2021. 4 of them have no drug coverage. 18 plans are HMO plans, and all of them offer some sort of vision, dental, and hearing coverage. Now, 14 of the plans with drug coverage have a $0 premium for everybody, and 2 actually offer you a discount on your Part B premium. So remember, these plans are giving something away to try and encourage you to enroll. So look at what works for you. If you're already enrolled in an Advantage plan, you should have had mail from the plan telling you what's happening for next year. Some plans have got premium increases. So if you have a Horizon Medicare Blue Advantage, the premium is going to go from $0 to $31 per month. I did work with somebody today who has that plan, but we applied for PAD for them, PAAD. And that will bring the premium down to $7 and change. So if you are a family member and don't want to change plan, but the premium's going up, then just check if you're eligible for PAAD and can get some help with that increased premium. Some plans are changing the benefits that they offer, or the copays, or the rules regarding networks. And there is one plan terminating in Mercer County called the Aetna SNJ Elite plan. If anyone has that plan and it's ending, then you would have a guaranteed issue right for a Medigap, or you can change to another Medicare Advantage plan. If people get beyond December 7th before they realize this, you do have an extended period in which you can make changes. Now, to find the most cost-effective Medicare Advantage plan, well, remember they have to cover your medications. So if you take any medications, you want to use the Plan Finder tool to look at which plans will cover your meds and at what cost. And then you can use the SHIP Medicare Advantage Plan Summary Chart for your county to compare your costs of medical care. I am very relieved to say that as of today, I now have this for Mercer County. And I can get access to it for other counties, because I know if you're in Princeton, you may be listening from Middlesex, for example. It's really helpful because it lists everything. It tells you what is the premium, what are the copays, is there a deductible? Some of these plans do have deductibles. What are the copays for primary, specialists, for different services? What are those special benefits? Do I get an over-the-counter benefits card? There is a lot of information. The chart, when printed, is definitely small, so you might want to have a magnifying glass, but if you've got it electronically, you can read it at a larger size. If you would like it, please just get in touch with me by phone, text, or email, and I can mail or email it to you. You do want to check your doctors are in network, but you need to be aware that they can leave the network at any point in the year. Unfortunately, you cannot. So you have to review your choice every year during the annual enrollment period. You may feel that the savings you get is worth moving doctors to get a plan that gives you the advantages, some of the lower premium costs, and a fixed copay when you go to the doctor. So just some final reminders. If you have original Medicare, make sure you take advantage of your free and reduced cost Part B benefits. So that's things like your annual flu shot, your wellness visit, and various screenings. You can see your Medicare New Handbook or check medicare.gov for a full list. I do have a list here, but if you look at the handbook or online, it will tell you how frequently you can get these screenings done and be covered. If you have original Medicare, and the provider accepts Medicare's approved rate, so accepts assignment, then there's no cost for these benefits. So it is worth making sure that you get what you're entitled to, but it's also to try and make sure that you stay healthy. Now, just a reminder to beware of scams. Keep your Medicare number safe. Thankfully, it's not your Social Security number anymore, but it's still your Medicare number, so look after it. And just remember, with COVID-19, if people are coming to your door offering you free coronavirus testing, treatment, or supplies, be aware. I mean, you can get the free test that's sent to your home, but it's people who unexpectedly just turn up at your door offering you, if it's a bit too good to be true. And don't provide your personal details or your bank information in exchange for a COVID-19 test. And remember that the open enrollment every year, October 15th through December 7th, that's when you need to think about it. And we are here to help. Say it's myself. There's also, we have a fleet of volunteer SHIP counsellors. So this is the contact information. So you can call or text me on 609-273-0588. I will try and get back to you as soon as possible. My aim is to always try and do it within 2 working days. If I can do it sooner than that, I will. And I can usually reply quicker to a text than I can to a phone call, just because it's quick for me to tap out a text. You can email me. I will always try and help via email. And as I say, you can always follow us on Facebook to keep it with what we're doing. Let us know if there's anything we can, if you need information or help applying for the programs to help with Medicare costs. I don't want people to be struggling, particularly if you're finding you can't afford medications or whatever. Help reviewing your coverage choices and costs, and any assistance during this annual enrollment period. Basically, any other Medicare questions, I will always do my best to answer. If I don't know, then I will try and direct you to the right place. And that's everything from me. I've been told I should not talk for more than an hour because people find it hard. So I will see if there's any questions. And thank you very much to everyone for attending and listening.
Cathy, thanks so much for such a tremendous presentation. We do have some questions from the audience. Ms. Jada James asks, what should be the deciding factor to determine if you should select original Medicare or Medicare Advantage?
Okay, so that's really going to be something that is very personal. It's up to you. So cost is definitely one thing, but I've certainly spoken to people who are on a limited income who tell me that a Medigap works better because you know what you're paying every month. You don't get unexpected costs. So it's really looking at, the other thing is your attitude towards risk. So a Medigap is, if you're somebody who likes to know what's coming, you want to know what you're paying, it is much lower risk. And it gives you the flexibility that if you want to get a specialist from New York or Pennsylvania, or you want a second opinion, you have that opportunity. But if you stay healthy, you will be paying more over the period of time with a Medigap plan. Vice versa, especially if when you are first enrolling in Medicare, if you have a health problem, so if you're somebody who's going through treatment for cancer or you're having to have dialysis, then you will make your money back if you get a Medigap plan, because you would be paying more as you keep using services for a Medicare Advantage. But none of us have a crystal ball, which is why I say for most people, it's do you back yourself to stay healthy? Because if you do, you will save money. But if you don't, it could cost more.
Thanks so much. The next question is, with a Medicare Advantage plan, why would someone select a plan with monthly premium when you have plans with zero premiums?
So the plans with a zero monthly premium, you will be paying more when you use services. So these are insurance companies. They are they do have to make money, or they have to balance the books, I should say. So if you go for a plan with a $0 monthly premium, then you will be paying generally higher co-pays when you see your primary or a specialist, if you're admitted to hospital, or when you use services. So it all balances out in the end, or if you can stay healthy, then yes, a $0 premium plan will work out less money for you.
Terrific. Thanks so much. And then I just want to remind everybody they can either ask any questions they have in the chat or in the Ask a Question section. The final question we had is, as you said at the beginning, this is a lot of information. If someone is 64 or 65 or over, can they just go to any SHIP or OSHIP office at any point in the year to learn more about what they need to do?
Yes, so Ocean would only be, so if you are in Ocean County, there is an equivalent of me in Ocean County, and there are volunteers in Ocean County. If you've got a question you want to address it here in Mercer County, we can help, but any of the counties will be able to help you. And what I would say is, if you've been to this and you're getting ready for Medicare, is this is just like a general entry. And then after that, I would sit down. At the moment, it's not face-to-face, but talk to one of our counsellors over the telephone or on Zoom, and they will go through it in much more detail to you. But having this bit of background means that you know a little bit more what questions you want to ask and what you might want to know more about. It is really hard with Medicare, but don't tangle yourself up in every little detail. Let us help you. Our counsellors do 6 days of training, then 2 update sessions a year, and we still have questions that we have to ask our state SHIP team, or sometimes even they don't know the answer because it is so complicated.
Well, Cathy, thank you so much for taking the time to try and help make this a little bit less complicated for all of us. And you did a wonderful presentation. Ms. James says, thank you for your presentation and for addressing my questions. And I think that echoes what other people are feeling. And I really appreciate everything you shared with us this evening. And just so everybody knows, this program has been recorded and will be available on this page to watch again. And you're welcome to share it. And we'll also put it on the Princeton Library's YouTube page. Cathy, thank you so much. Do you have any closing remarks?
No, it's just, would you like me to send you a copy of the presentation so you can put it up alongside, or as in the slide set? Just let me know if that's what you'd like to do.
Yeah, I think it'll all have been captured in the recording, but thank you so much.
Okay, fantastic. All right, thank you very much.
All right, have a wonderful evening, everybody. Thank you for coming.